This is where the first logical fallacy arises that undermines the whole scientific process, which we will examine next. The appeal to ignorance fallacy occurs when we state that there is no evidence because we have not looked. Even at the local level in Utah, health officials continue to make claims based on the ignorance fallacy, such as this communication that we received by email from Leisha Nolan, the Utah State epidemiologist. She stated that the vaccines do not modify the genetic code without providing any references. She gets paid nearly $250,000 a year. Is this how much taxpayer money we need to spend for her to appeal to ignorance?
Fact number 4. COVID-19 vaccines don't change your DNA in any way. They trigger an immune response that creates antibodies to protect you from getting infected with COVID-19.
And a sample scientific communication that is spread far and wide by the Utah Department of Health goes something like this. Beachbody.
What would you say to those, whether they be in government or medicine, that claim that these adverse events and deaths are rare?
Wow. I would encourage them to actually talk to the people who have seen them. I saw just a huge number of reactions. I would say close to half the number of people that I saw get the vaccine had at least moderate reactions, with close to a quarter of them having severe reactions. Again, we're talking vision loss, strokes, the degenerative brain disorder, losing all strength in their legs, losing the ability to walk.
In fact, this was one of the first fallacies that occurred during the beginning of the scientific revolution. The famous Galileo offered his telescope to the learned men of his day and asked them to look through it to decide whether he was speaking the truth. Several people refused to even look through the telescope.
There's a friend of mine who is a nurse, and I was telling her about the reactions I've seen, and she goes, "Well, that's interesting. I haven't seen any reactions." This was about a year after the vaccines were released, and I said, "Really, you haven't had seen any reactions?" And she said, "No." And I said, "Have you noticed an uptick in neurological problems, in strokes, in severe muscle weakness, in vision loss?" And she said, "Yes, actually, now that you mention it, there has been quite an uptick in that." I said, "Have you looked back in their medical records to see how many of them happened recently following a COVID vaccine?" And she acknowledged no, that she hadn't. And I said, "Start looking." And a couple months later, I ran into her again, and she actually acknowledged that she had started looking and was absolutely floored that almost every single case that she was seeing had happened within a week or two of them receiving the COVID vaccine. It was something she had never even thought about before, because she was so ingrained in thinking that it couldn't be that, or we don't need to look. I mean, if you're not looking, you're not going to see it.
In 4 centuries, we are back to square one with regard to safety data from the COVID vaccines. The government and the pharmaceutical companies have both refused to look. If our analysis of data includes reasoning fallacies, the very foundation of the scientific process collapses. Let us see how the reasoning holds up on other aspects. A Freedom of Information Act request asked for documents to support the CDC's claim that the vaccines did not enhance the variants of the virus. And the CDC failed to find any such records. But they went on to argue that they failed to find records because the vaccines do not create or cause the variants. This is a classic example of circular reasoning. The records do not exist because they cannot exist, and our claim is not based on any scientific data at all. If the CDC and FDA have not studied this data, what about the doctors themselves? What about the American Medical Association, which is a premier scientific organization of medical professionals? Did they do their own analysis? No. They simply depended on the FDA and CDC to monitor the safety, which we have seen that they have not done. In other words, they simply appealed to the authority, which is another unscientific practice that we have seen in the last couple of years. Not only that, even academic institutions themselves have chosen to actively promote unscientific practices, as this example from the University of Kansas shows. They argue that vaccine selfies must be encouraged. because they create the bandwagon effect, which is another logical fallacy. The appeal to authority and bandwagon fallacies combined have created a virtual epidemic of unscientific reasoning in almost all the organizations in the world. The last logical fallacy we would have to examine involves the way we understand the side effects from the COVID-19 shot. It has been declared by all the medical authorities, including the Intermountain Healthcare locally in Utah, that side effects are a sign the vaccine is working, with no further qualification.
Our Larissa Scott explains why so many people are having a reaction and why doctors say it's a good thing.
Experts say the reason why more people are having a reaction to the COVID-19 vaccine than they would the flu vaccine, for example, is because this vaccine is made a little differently.
It really means that your immune system is sort of ramping up.
Especially as the CDC has not analyzed the reported side effects. How can this be claimed? Does this include severe adverse events? Does disability and death show the vaccine is working?
And what the FDA did with Johnson & Johnson is so stupid. 6 people
out of 7 million
experienced some difficulty. 6 people, and that's too bad. It's terrible. But they paused it. That's the worst thing you could have done from a public relations standpoint.
And I think we had a lot of good uptake on the Johnson & Johnson in March and into April. We saw a noticeable decline in J&J when they pulled it back because of the FDA. I think it was a huge mistake. I said so at the time, and I think that sent a message that maybe this is not something that they should be doing. I think that's been unfortunate because I took it. I think it's effective.
This is a big problem in science where a statement can never be proved false. It's called the lack of falsifiability. The Hill referred to this problem as the science is settled until it's not. For example, what happens if there is data that could show that the shot is either unsafe, ineffective, or both? We can refuse to analyze the data and continue to declare that the science is settled, it is safe and effective. Or, if we do admit that there is data, we can say that the data is not finalized yet, since science is evolving. We did not know. Either way, there is no scientific pathway allowed to disprove the safety of the vaccines.